Welcome back to my YouTube channel. I am Brittani Naccari Farrell with Timeless Touch Medical Aesthetics. Today we are going to go over tox boosters. So we're going to do the VI peel, and with this patient in particular, we're looking to get rid of melasma and any dark spots on the face. So we are going to choose the Precision Plus. And this will help her peel over the next 7 days. She can repeat these treatments every 4 weeks. The recommendation is to do them 3 times. And then I like to tell people to maintain the look of their peel using good medical grade skincare. I do prefer to use Revision. That is what I did cleanse her face with today. And also doing a peel right before summertime and then right after seems to really do the trick to keep the melasma at bay. So we'll do that today, and then we're going to use our Xeomin toxin, which is a neurotoxin. It's pure tox. So this goes through a second filtration process, does not have all the additional proteins. People typically do not develop resistance to this neurotoxin over time, and their dosage should stay about the same overall. So we'll get started with that. I did already cleanse her face. So in our VIPL pack, she will have an at-home kit, which we will give her to take home with at-home instructions. So she'll use the peel wipes over the next 2 days to continue to help promote peeling with this. And then there's also some hydroquinone in there with itching. There's a cleanser that she's going to use only these products for the first week after this procedure. So, so we'll get all this out and mixed. And the first step is going to be to use the prep towelette, which is going to degrease the face to allow the product to penetrate more to get a better peel. So once we get these mixed in, we can start there. And then as far as doing VI peels, ways for clients to get better results is based off of the pressure that the provider is using. So you can get deeper and better results by giving more pressure and a better peel. So for clients with this, I tell them if they are peeling in sheets to use scissors to cut and not pull this. So we do not want to scar the skin or cause any irritation by peeling the skin. So you just gotta kind of leave that alone. And her results, will be there at 7 days. I've seen the longest person that I've done so far really peel, 8 or 9 days max. And then some people may peel the slightest bit less than that, but I would say the 7-day mark is pretty realistic. Day 3 and 4, usually the worst on the peeling. You can wear makeup with this peel, so you are getting rid of the old skin and getting new skin. So none of this is damaging to the skin. There is no healing process that's really involved with this. So wearing tinted sunscreen or wearing makeup is okay during this process. Now, when she gets, now in 2 weeks, she'll see, full results with everything, including the toxin. So her lines will have smoothed out, the darkness will have peeled off, and she'll have great, beautiful results. So it is really nice doing this in conjunction with a neurotoxin. So this is just getting the grease off of the face. And I will also go down her neck with the last couple of passes. So we'll grease that as well. We'll do 1 second pass with this. So a few good things about the VI peel. VI peels are also okay and good for people with rosacea. So many treatments people with rosacea can have a tough time with because it's going to flare the rosacea. VI peels are safe for clients with rosacea, and we can do the original peel on them. Like I said, these Precision Plus peels target the dark spots of the face. So they are great for clients with melasma. And I feel like that is definitely something that you see a lot. And that's something that people really want to focus on and work on a lot. So this is a great option for people with melasma or any dark sunspots to help lift that discoloration and hyperpigmentation. You doing okay? Mm-hmm. So we'll continue her passes here. This is not a peel that really needs to be fanned or anything. You typically don't even really feel any burning. Some people may get occasional tingling, but nothing too bad. So it's not something where you feel like your face is on fire with this. So it's a nice kind of easygoing peel. And we'll just continue to go in different directions. If anybody does get any type of little, frosting spot or an area that's just more sensitive, we can continue the peel on other areas of the face while that calms down, or stop on those areas. It doesn't mean that your whole treatment needs to be stopped. So you will still get great results. I've done many of these peels before. I have not had anybody come back with no results. So it's definitely a great product. We do also carry the advanced peels, and with the advanced peels, those are for anyone with aged skin. So aged skin is considered over 35. So those are great for fine lines and wrinkles as well. We do also carry the Purify Precision Plus and the Purify and the regular Purify, and those are great for people either with acne. Some darker skin will do better with the Purify. It does help with any type of oily skin. So we really have a treatment for pretty much all skin types. This product can be used on skin types 1 through 6 safely, and any of the aftercare products that go with it are safe to use as well on skin types 1 through 6. So this is a good product to use, especially if you have darker skin and have concerns of not necessarily being a candidate for certain procedures, and concern for hypopigmentation. You don't want to take any of that beautiful color out of the skin and leave it with spots. So this is a nice, safe option. So we'll have one extra little pass, and then I'll go through and do her toxin, and we will come back and use that last little pass here right after her toxin. This product basically has is going to cleanse the skin as well. So this is used as her prep for her neurotoxin. And then I can use this same little gauze here with the product on it to dab any of the holes where I've inserted the toxin, if there's any blood or anything there. So when she leaves here today, her instructions will be not to do anything for the first 4 hours, and then follow her instruction packet. But we're not going to send her out with sunscreen or anything on top of this. We're just going to let the peel do its thing for the next 4 hours. She'll wash, she'll use the towelette, and then do that again tonight before bedtime. All right, lift your eyebrows. Relax. So we're going a little higher up here so she can get a nice lift. That way we're not dropping any areas here, but she's still going to get a nice smooth forehead. Lift again. Relax. With all neurotoxins, your dose is your duration. So with her, we're going to do just the frontalis muscle, so the forehead, as well as her glabellar area to help lift. So again, you can use lower amounts of units. You just won't have as long of lasting. So if you're looking to get the longer last and have full dosing, that's usually your best way to go, because you may not have to come every 3 months or so. Some people can get that 4 months. Some people get 5 or 6 months. It just depends on the patient. But you also have less likely to get resistant to any of these toxins if you're not doing them every 8 weeks or so. Neurotoxins are injected using insulin syringes, so very tiny needles. So it's not a super painful thing. It's like little tiny bee stings. Very tolerable with patients. She does not have numbing on It's not really necessary for this. If you are nervous or it's your first time or you just prefer to have numbing, we definitely can offer that here at Timeless Touch, but you don't have to do it. Frown for me. Relax. Frown. Relax. All right, and then lift your eyebrows straight up. Give a little brow lift here. So the eyebrows lift up again. Stay right where we want them, and you don't see any drop there. She gets a nice little lift, so her makeup goes on nice and smooth, but she doesn't look, spocky or anything like that. So we'll just go over with the rest of the peel just to smooth everything out here, make sure it all looks good. So that is it. That is a complete treatment of getting a tox booster using our VI peels with the neurotoxins. So we'll send her some extra little paperwork to go home with to make sure she understands all of her instructions. We do answer our phones 24/7 if any of our clients forget or have any questions after having their procedures here. There will be a nurse practitioner that you are able to talk to at any point in time. If you like this video, please click subscribe to follow any more of our videos here with Timeless Touch. My name is Brittani Naccari Farrell, a nurse practitioner.